So it is wonderful to have such diverse panel presenting both academia and practice in our panel. And let's talk about our first theme, which is innovation through collaboration. So my first question is for you, Sarah. From your perspective within academia, what are the current research priorities in healthcare design? And how are universities approaching this work, and where do you see the biggest opportunities for collaboration with practice?
Thanks, Anna. Very big question. So I had to divide it into 3 parts to try and make it manageable. So I think one of the big things that universities are looking for at the moment is big impact. And I think, we're trying to generate what's a big impact? How is this research going to generate impact? So how do we fund it? What's the impact going to be? But that sits in the face of small moments, pilot moments, small steps, having little things that can start to demonstrate those big impacts. And I think that's a bit of a priority at the moment is, we saw a great example of it earlier with the Washan Basin research. It's a small step, but it has a monumental impact. And I think dividing those, identifying those little opportunities to have a big impact rather than tackling a massive thing all at the same time is a big priority, I think, within academic, but also within healthcare research. How are the universities approaching this work? Well, I think when I first joined Deakin, I got invited by the health facility to come to an event called Big Bids Boot Camp in Aged Care. And it was on the back of the Royal Commission, and they basically got everybody into the room from all disciplines, all areas, to unpack what was happening in the Royal Commission on Aged Care and what could we do about it and who should we have in the room and who should we do it with. And it was such an exciting session because it was so multidiscipline, so multi-layered, and really looking at policy. And I think, that's a real opportunity. For me, the big gap was there was no practitioners there. It was just academic. So I think if you're asking about what's our opportunity is to bring those things together, to come together. I think I've lost it. To come together and to really unpack some of those and look at the little pilot studies, the proof of concept, the small steps that can start to come back to the big change. That we look for small pots of money to fund small amounts of time, limited number of students, to then start to build them together in a bigger elephant that can make change.
That's a really good point. So I think that it really aligns with the next question. So because you just touched on the collaboration with practice. So Jacqueline, in your role leading research within practice, how do you decide which areas to focus on? And what makes a research agenda strategic rather than reactive to project demands?
Thanks, Sanaz, and thanks for inviting me to this panel. I feel really honoured. So there's different ways that we decide which research to focus on, but one of the ways we do this is by looking, first of all, at the biggest issues that are facing our cities. So, for example, growth, sustainability and equity. And then from there we think, well, how can architecture impact these issues? So how can we help in that way? And that's how we decide to work on research programs such as modern methods of construction and prefabrication. That's how we decide, because we're across many sectors. We're across around 12 sectors. But at a sector level, what we do is we ask, what are our clients' biggest problems? So what are the biggest issues that our clients are looking to solve in the next 5 or 10 years? And then we also look at what is the future of each sector. So what's going to happen in the next 5 to 10 years in each sector, and how is the role of architecture going to change?
Thank you so much. And Rebecca, you've been part of several long-term research partnerships between universities and practice. So from your experience, what helps those collaborations succeed and what makes them hard to sustain over time?
I was thinking about this yesterday, actually, when we were looking at the House of Research and the conversation we had afterwards, which is great research, by the way, big fan. I think realism. I think realism is the key thing that we so often overlook. So, and speaking to the tension that Sarah did, universities want the big ideas, right? Everyone wants the big publications. But what we know, and I think partially it's because I came at this as a practitioner and partially because I came from New Zealand, so I was just very impressed when I got to Australia and saw all the healthcare work. Like, how do you guys know how to do this? Often it's just putting evidence behind what's already there, right? Like, there's so much good, innovative thinking in Australia, but we haven't recorded it and we haven't documented it. So you don't have the piece of paper to go to a stakeholder. This is why this investment makes sense. And we heard a lot the last couple of days, better, faster, cheaper. Great. I think we all know that when it comes to architecture, the better's never really better. Right? Like, that's the bit that often falls down in that sort of triad. So I think those conversations that we can have to shift that value conversation, like, yes, cheaper, faster is great, but also better needs to be a big part of that. And it doesn't always have to cost more money, but it maybe takes a bit more investment of time and collaboration and thinking forward and all of that stuff.
Thank you so much. So realism is really important to just see the opportunities and also challenges together. So I think that, yes, the second part of the panel discussion is about navigating barriers and unlocking opportunities. So Jacqueline, this question is for you. From the practice side, what are the biggest constraints you encounter when trying to do research within design practice?
They would have to be time, funding, and the team, and also working out what to prioritise. So in terms of time, we never have enough, and doing a research project, we have to be careful who we collaborate with because time may be an issue for the research. So if we do a piece of research in-house, the shortest time frame we could do it on would be, say, 2.5 months. And often when a piece of research is requested, it's needed yesterday or it's needed, for a presentation in a month or two. So time is a real issue. The other thing is team. So when you employ team members, generally researchers, as we all know, especially those who have done a PhD, we're very focused on a particular area. So it's difficult to get a researcher in practice that's a complete all-rounder across 12 sectors. It's kind of impossible. So sometimes when you get these great team members who might have a focus in healthcare, they might not be able to have a focus in other areas as well. So the way we manage these constraints is we try and get clever with the initiatives and the resources that are out there. So they include grants, things like the APR internship, which is an opportunity that postgrads have to work with practice. So we would take on an APR intern for around 3 months. We get a 3-month project done for a small amount of money, and the postgraduate gets a stipend from the program. There's also other really great opportunities, ARC linkages and ARC training centres that we've had a great deal of success with.
Great, thank you so much. And by the way, thank you so much for I remember a few years ago you had a series of the webinars, Research in Practice, just, discussing the existing issues and, challenges in practice. So, I just wanted to thank you for that because of the sharing the knowledge and see the realities in research in practice. And Sarah, what are some of the main barriers you face when collaborating with practice?
I think time is obviously a really critical factor. Getting the right questions at the right time. So the right research questions for the right time in the practice, and then having the time to do it, robustly, is a real difficulty of the two times. We're on different timescales to a certain extent. And the other thing is access, I think. Access to voices and marginalised voices. The last session we heard a lot about the clinical voice, but from my perspective, for instance, in aged care, I've just finished a focus group with personal care workers. Nobody's ever talked to them before about their building, and there was very little access to them. It was their lunch break. We had to field lunch in order to be able to talk to them. So access to the marginalised voices is really important in buildings. Particularly, I think, as Rhonda has pointed out so many times, the infrastructure is one cost, but the people cost just goes on and on and on. So if we can work with organisations who want that marginalised access, that's, fantastic. But working that out and putting that into a funding bid is really difficult. And of course, the age-old thing of what publications you're going to make, because in a university it's not research unless it's published, right? But most people in practice don't read academic publications or don't want to. Who would? But a quick video is great, but that's not acknowledged. So we're on two sides of a table. We had some jokes at the workshop on Monday about making reality TV, how I met my researcher. Those sorts of, if you make it for public consumption, you can make research translation quicker, but the academy doesn't count that. And if they don't count it, it means you don't get time, you don't get funding, you don't get career, you don't get a job. So, they're on different wavelengths, and I think somehow we need to weave research translation and research together and broaden the definition of what publication is beyond the academic paper, which is, on the nose with most people these days.
So it is the importance of the applied research, so how we can translate all those research data into the really applicable strategies for practice. And Rebecca, would you add any further reflections from your experience working across both domains?
Yeah. Look, research and practice is really hard. I do it, and sometimes I'm like, why? Why do I make life this hard for myself? And so I think I think it's worth trying to see both sides of the fence. So I had a really formative experience with Cody, who I don't think managed to be here this morning, where we stopped talking for a couple of years because we were just fundamentally opposed on this research issue, and we're friends again now, so it's all good. But this is how heated it gets, right? Because I was coming at it this needs to be more rigorous, and she was like, if we spend time, it will not go in the building. This is not an option that we have. And I think we all like to talk about industry, academic collaborations, but I think so often we don't really understand what's at stake for both parties in those collaborations. So, I kind of have a lot of conversations with people we'll get some university research funding. For starters, if I knew how to get that, I would be in Boston right now. I wouldn't be sitting here with you guys, so no offence. But university research funding is it's hen's teeth. I don't know anyone who's getting it anymore. It's just not. It's just dried up. But also I think understanding that if you are engaging a researcher, yes, they want to work with you, but yes, they're making some compromises in that process, right? So I have to work really hard to get our industry research into top journals, and it's like banging my head against a brick wall. But if I don't, then my academic career is held back. So, and also, we know for you guys, working with researchers is super frustrating. We get that. We're sorry about it. We try harder. But I think just acknowledging, what are the real constraints we're dealing with here, and then how do we navigate those together is probably the most useful thing we can do.
Great, thank you so much. And now let's highlight the role of architects, because of our background, we are all, our background is in architecture. So from your experience, Sarah and Rebecca, this question is a common question for you both. From your experience in academic healthcare research, how are architects currently involved in projects, healthcare design projects? From your experience in academic healthcare research, how are architects currently involved in healthcare research projects?
I mean, not enough is the answer. But again, in saying that, I spoke about this on Monday. I had a grant to do some ethnographic work because I was like, okay, we get an umbrella ethics application. It's going to be magic fix for everything. I'll just sit and practice, and I'll just wait and see what the projects are, and we'll do them. And when I got there, and even though I came from practice, I was like, oh, right. I was like, I'm here now. Let's do some work. And I was like, oh, okay, so you guys all have deadlines. No one can talk to me till 4 o'clock. I forgot that this isn't what you do, and actually you have all these other priorities. So I'll just sit around until you're ready. So it's not happening enough, but it's easy to say that, and it's really hard to fix, I think, is what my point is. So I think it's really valuable when practices can say, here's the question we really want an answer to, and we kind of know the answer, but actually we need the piece of paper to be able to get the stakeholders on board, right? Because then we sort of know what we're dealing with, we know what we're trying to prove, and what the value of that thing's going to be.
And how about you?
I would say mostly it's by luck or by chance that you've come across somebody who's interested in a building type, and then you kind of go, oh, we could do something about that. But it's not really a pathway in which we are automatically joined together. And, there's that, the disability research phrase, nothing about us without us. So often as researchers, we're looking at buildings, but without the architect involved. And I think that's a real shame, because there's, we're not coming at it from a critical, you should have done this perspective, because often we know how often buildings change between the very early stage to the design stage to the construction stage, and then somebody else moves in and runs the building completely differently. So I think it's not a blame game, it's a learning game, and we need to be in that together to try and work out how we do it better together. And so some of my projects haven't involved the architect at all, because they kind of go, oh, the building's finished now, why would I want to do that? And then when I've gone back to them to say what the findings of the research were, they were like, oh my God, so it actually worked. I thought that's what we were going to do, and it really did work. That's fascinating. But they weren't involved during the stage. So I think one of the things Rebecca and I talked about earlier was this is research and practice, but we're practice in research, because we're the reverse. We've come from a practice background and now are in the research. So it is slightly different when you have that discipline understanding to be able to bring a multidiscipline team together, knowing the constraints that have happened in practice, knowing the difficulties between the lived experience and the design process and management changes and, things that happen along the way. So I think there should be much more of it, but, and I've got some suggestions for the last question. I'll leave it there.
Thank you so much. And Jacqueline, in your experience leading multidisciplinary projects, how does collaboration work on the ground between architects, health professionals, engineers, and researchers? And what makes those collaborations successful in practice?
Collaborations that are successful in practice are where all of the parties have a unique value that they bring to the table. And so if the unique value isn't there, there's not much point in having them. And the great thing about collaborating in practice is that you can really increase your reach, but you can also expand the audience. So we're not producing peer-reviewed papers, so we're always thinking about reach and audience. And we've had some really great successful collaborations. I'll tell you about a couple of them. So the first one is an example of a collaboration with another commercial company, and then I'll tell you about a couple with academia. So the first one, we collaborated on a white paper called landside master planning for airports, and that was with a commercial, like a commercial planner. And so the great thing about that paper was that it brought the knowledge of our architects and our precinct planners together with commercial planning, and we were able to write about something that airport CEOs were really interested in, and that's resulted in a lot of leads globally for airports globally. So that was great. And the great thing about that one is it took about 4 months from idea to publication of the white paper. The next one I'm about to talk about is quite different. It's an ARC linkage grant, and it's called Thriving in Vertical Schools, and we're an industry partner on that grant with QUT. Now, it's been the most amazing opportunity for us because we're not the only industry partner. Our clients who have vertical schools are also industry partners. So for us, we feel so privileged to have all the POE data and great research that's been done with student voices. That has been developed into papers, and we're also co-authoring books. One of them is called Design Patterns for Vertical Schools. So that's been a really wonderful collaboration. And the final one I want to talk about is called ARC Manu, and it's a training centre ARC grant, and that's being done at the UNSW, but we also have Swinburne and University of Adelaide on board. That is a fantastic grant, so it goes for 5 years, and one of the great benefits for us is that we're able to apply to get the PhD students to work on research problems, and we currently have 4 PhD students working with us for 3 months each. So the deal is that we're a major industry partner, so we do contribute some cash, but most of what we contribute is actually in-kind time, and that's really valued by that training centre. And that relationship is definitely mutually beneficial to both, and I think that's the key.
Great, thank you so much. And what I really like about the white papers from practice is, the communication style. When we compare the white papers, to the journal paper, maybe at the same time as academic, we need to work on our communication style and how we can better communicate our design ideas or design strategies to the authors as well. So now I think we have plenty of time. So Sarah, we would love to hear your suggestions or recommendations.
I think one thing that we could do easily is try and break down the silo of academia and practice. And I think, there's, by having things like the research training centres, by having PhD students that may be working in the practice that are supervised jointly by a practitioner and jointly by an academic, the academy has the wherewithal for the certification of a PhD, it has the rigour, it has multidisciplines. We have health departments, for instance, or education departments. So you can get this multi-perspective. And then we build capacity for research and practice, but we also build capacity for practice in research, the other way around. So that we can have this future generation of practitioners who are used to research and who've been co-funded, if you like, by the postgraduate funding schemes, but also by continuing their work in practice. Because I think the idea that you give up 3 years to leave practice to go to a university stops the clock in your practice career, right? And then you're at the very beginning in your research career. Whereas if we can have them so that those 3 years are embedded in both, it's a double whammy. We're doing double masters.
I'm going to say we need to get over the economic constraint, though. Like, I have so many brilliant students who are now working in healthcare, and I'm like, come do a PhD. And they're like, do you know how much you're getting paid in practice? I'm not going to give up that salary. So unless we've got a way of negotiating that.
Yeah, and I think that's what we need to do, is negotiate
and maybe that is more of a sort of an industry investment, to be like, if this is what we want, we need to find a way to start funding these PhDs in practice.
Yeah, I agree. And that way we build the capacity. But you can't, people are not going to live on a PhD stipend as a mid-career. So it's got to be the combination of the practice salary and then a couple of days a week is the PhD stipend, and the two work together. But at the moment, the government is very set in full-time PhD, living on the poverty line, versus stay in practice and don't do any research. And it just doesn't work. We need mid-career people, people with families, with lived experience, people who have their own caring responsibilities, and they can't live on a PhD stipend in their mid-career. It just isn't feasible. So I think there's a government shift that needs to be sorted in that PhD stipend plus industry salary, so that you're in both at the same time, joining them together with this, tackling the same problem.
Any other suggestions, Jacqueline? Would you like to add?
I don't know who or how this could be done, but I think architects, designers find it very difficult to understand your research outcomes. So we touched on this before. We don't tend to read peer-reviewed journals. So we need a way to translate the research into a digestible way for designers so that they can pick it up and digest it or consume that research within 2 minutes by making sure that it's really visual. Another thing I'd really like to touch on is that I think academia needs to be really careful that they don't come across as just looking for our money when they want us to join projects. So we really want to be your partner for the long term. It's not just a transaction where we go to university and say, we want you to do this piece of research, here's some money, and then the relationship ends. No, we're looking for that long-term relationship. So we want to be part of developing the research project in the first place because we've got a fair idea of what the biggest challenges and what the biggest issues are. And I think by recognising that you need us to actually form the research idea and then help you to apply to government bodies or wherever we're going to get the funding from together, I think will make it more successful. And also understanding that mostly with designers, what they can contribute is generous in-kind time. And we don't actually have a lot of cash to give. We will have a small amount, but that's not going to be our role. Our role needs to be that we're your partner.
Thank you so much. And I have one final question about the research funding, maybe. So sometimes we have great ideas and we have already identified our, in academia, in a practice partner. So, but it's really challenging to get funding. So what's your experience?
Look, I think this is what I was trying to get at earlier. This idea that, practice gives us funding and that's awesome, but it's never even close to enough money to get the research done. And that's not a criticism of practice. I know that you're not dropping money out of your pockets either. But I think this perception that, we'll gift you the money and you'll do it, I think that the researchers, and there are only a few of us doing this kind of work, it is a risk and there is a lot at stake. I mean, half the people I work with have no idea what I do, and it's really nice to come here because you guys all appreciate it. But they're like, oh, you do the aged care thing. I'm like, I've never done aged care. So, we really are, we're putting ourselves on the outer and we're taking a lot of risks, and it's worth doing. But I think an appreciation that actually everyone's got a lot at stake for different reasons and in different ways, and that there's no sort of, one person's giving more than the other. Or I think if we can get past those kind of things, it'd be super helpful. Yeah.
One of the things that I think isn't tapped into by our area is philanthropy. So I've been to a number of workshops at Deakin run by professional philanthropy organisers, and it's a very interesting field because this is to fund research, right? So a lot of the philanthropy funds things like plastics in the ocean, cancer, curing cancer, those sorts of things. And so I didn't see what the role of me going to this workshop would be until they explained that usually people give large, significant sums of money for research based on a negative experience. So one of the stories that was shared with us was about an American woman who gave an enormous amount of money to build a library in her small town, or to have this library designed at a high level and to build a library. And she was a former education, she was an English teacher, actually. And so it made sense that an English teacher would give this funding to build this library, until the end of the clip, when she said, "Do you want to know why I really gave the funding to build a library?" She said, "Because I came from a domestic violence background, and the library was the only safe place I could go with my children. And so that's why I funded a library, as a space of safety." And, that suddenly I thought, well, my goodness, why aren't the built environment research getting funding? Because there's so much negative experience by bad, historic buildings and experiences.
The Novel project was entirely philanthropically funded. And I know a lot of you here will be familiar with that, but that had much better funding than you'll ever get from the Australian Research Council. Maybe we need a masterclass from Julia Bernhardt on how she did that.
Great, thank you so much. And now I think it's the time for a rapid takeaways. So would you like to add anything, as a takeaway for this panel? Some recommendation, some summary of the panel. Or maybe reflection from the workshop that we had on Monday. Any reflections?
I think research translation is a huge one, because we're not getting traction. We're doing all this research, then we're hiding it in the bottom drawer in an academic journal, and then we move on to the next one. Then we put in for research funding, we don't get it. We've spent months with, herding partners, councils, departments, all sorts of people to work together. Then we don't get the funding, and all of that's put away, and we don't reiterate it again. So I think that trying to get the translation out early so that we see the benefits. The numbers were very clear in the presentation, the awesome presentation that was made by the Washan Basin, Michaela, showed us like this small thing with this huge impact on the numbers. That research translation is really, really important. I mean, the 3-minute thesis should be for everyone, not just for PhD students.
Yeah, I would add on that though, because I don't think it's just the translation. So I was very lucky to spend some time with BVN, and when I showed up, they were like, "By the way, we're doing these palliative care facilities, and we've read all your research, and we're trying to put all the stuff into them." And it was just like a gift. But then understanding, well, what of that will actually travel through a procurement process and what won't, right? And like Cody was talking about yesterday, they've done these great mental health facilities, but people will now say, well, they're overperforming, so what can we cut out of them? So really understanding, again, the realism of what we're trying to do with this work, and how we can get it into buildings, I think is another critical part of the puzzle.
I think for design firms, I'd like to see more access to formal research partnerships such as ARC linkage and training centres, because at least for us, I feel we get a lot out of them. But I also think of just incentives more widely. There's the R&D tax incentive that some design firms are eligible for, which is a really worthwhile incentive, but other, hopefully, government funding and ways to come together that are mutually beneficial.
Thank you so much. So I think that it's now the time to open the floor for the questions and start the Q&A.
Wonderful, thank you. I really enjoyed the discussion. I just have one quick question, perhaps. I'm thinking doing robust research and evidence-based design sometimes needs some skills, I would say research skills, that are not necessarily similar to the skills that we develop as architects. I wonder if you have any thoughts about teaching these skills in master's degree probably, and how we can do that, because I know that we don't have it right now in our curriculum. So I'm really interested to hear your thoughts.
Sydney, but that's just boasting, so.
I think we automatically jump to formal education and masters and grad certs, grad dips. I think we need to tie in more with the continuing professional development world, because we don't have time to do full masters. Universities don't want us to do more and more masters with more and more subjects, whereas I think the CPD is where we need to have the short, sharp things that are available and ongoing versions of those, so people can upskill in bite-sized pieces as they go.
At Cox, we try to upskill our staff and we offer grants, research grants. This year we're offering 6, so we have 6 people going through a research program, and so they get skilled up in methods and just doing the entire project, which they get 7 months for.
On a more serious note, when we did the article that was up before, one of the practices we talked to, and I think it was through a linkage grant, but said because the researchers came in and worked with their staff in terms of how do we evaluate this building type, they said it upskilled their staff in a whole bunch of new research skills they didn't have before, and then that sort of fundamentally shifted how they did their end user consultation. So I guess those are the intangible benefits of these collaborations.
Hi. I was curious if you guys could talk a little bit about the potential role of mentoring in the health design community. We're now kind of like 3rd, 4th year of our scholarship, which is to Masters and PhD students, and Sarah being our latest one. What could we be doing to get our PhD graduates into industry, partnering up with the right people, or bringing more people into the research and design industry? Where can we mentor in a useful way?
I think the new scheme where PhD students can go into placements, you might have submitted and it's going to be a couple of months before you get your final results. That starts to bridge that mentoring so that the supervisor and the employer work together to get a mentorship situation for the student. I think that works well. And I also think most supervisors maintain a very long line of mentorship with their PhDs as they've gone through, so that you end up with not just your PhD student, but the PhD student of the PhD student of the PhD student. It becomes a kind of a Russian doll situation where you get that sort of mentorship. And if we can have that alongside with the practice, I think that works really well, and to bring those through together. And the training centres that you mentioned, I think.
Yeah, the program that Sarah's talking about is called the APR internship. And this is a really good opportunity for PhD students when they've handed in their thesis. They usually have, 3 to 5 months while they're waiting for it to be marked. So there's an organisation that companies like us go to with research projects, and they advertise it amongst all of the PhD students around Australia, and it's usually open to Australians and international students. And sometimes the Australian government offers an additional grant. So we have had 3 in the last 2 years, 3 APR interns, and they've all been PhD students. And 2 of them, the government actually 100% subsidised it, and it cost us 0. So, there are some really good opportunities for these students.
I also think something that the council could do is advocate for research at a sort of state government level. So we had an experience recently where we knew they're building a new children's hospice at Westmead, and I must have sent a dozen emails going, I have a PhD student studying this right now. Can we help you? Can we talk to you? Can we help you write the brief? We just want to make sure it's going to be a good building. Never got a reply. Thankfully, BLP now have that, so we know where to send all of our knowledge. And this is not unusual, right? Like I talked to people when Manly was built who said, we did all this stuff on Hummingbird and we just want to help, and no one called us back. So I think there is some work to do in terms of connecting up who's doing what, understanding, where those connections can be really helpful in getting better healthcare projects.
I mean, I think the palliative care is a really interesting one, given that, there's 3 of us in the room that are, have got probably some of the best experience in the world in palliative care, and yet never been invited to discuss the briefs for the various palliative care units that are being built.
Yeah, for those who don't know, Sarah's book is amazing, and I recommend reading it.
My own experience. I graduated in 2023, and at the time, so there was a kind of opportunity at the university, so we could apply for the industry placement. So I, APR intern is one of the programs, but at the time there was no kind of a related project to my background. So what I did, I negotiated with the university. So I had a research proposal. I have an industry partner, potential industry partner. So is there an opportunity that you can fund this project? And it was successful because I approached a BLP. So I developed a future-proofing conceptual framework, but at the time, I didn't have any clear, design strategies related to those concepts of the future-proofing. And by analyzing 4 hospital buildings, so we, with, designers at BLP, together we tried to connect the concepts to the real design strategy. So I think that it's one of the connections that you just talked about.
Thank you. It seems to me, listening to you guys, that it is quite siloed and everyone's coming at it from their own perspective and trying to do it by themselves. And I think to your point, Rebecca, can we, the collective we, under the Australian Health Design Council, actually start to think about a research system, to bring it together? Because this room collectively has got a lot of experience and a lot of things to add. And do we need, just reflecting on what Dana was talking about, yesterday morning around, do we need a research system that actually has, advocacy, has connections, has, those kinds of things behind it? And Kate, I'm going to put my hand up to help to manage that, because. So do we need one? I think everyone's nodding. And what would be the drawbacks of that, of having a research system? Are there any issues, that you guys could see with that from I mean, that there's actually a structure, the way you can go, Rebecca, rather than you trying to, navigate the New South Wales government, that actually the Australian Health Design Council, with you, is actually navigating the New South Wales government. So advocacy, trying to raise because we all have the same conversations and we all have the same issues at various levels of going, hang on, we know this is a really good idea. And I think you mentioned, that sometimes we need a paper to defend to a client, that this is a good idea. So we all need it, but our needs are all very different. So I'm kind of going, well, if we all actually got together and had a system about what's everyone's need.
Power of partnerships.
Yeah.
Yeah, I think it's a great idea, and because, with the universities, we're not actually in competition with each other. We're trying to work together with each other, multi-teams, multidiscipline, multi-universities. So we're not bidding for the same, we're not bidding against each other. We're trying to, researchers hunt in packs is the phrase. So I think something like that brings us together.
There may be some practice, some practice and competitiveness, but I would like to think in this room that actually the conversation about raising the design standard of our health design, places is actually more important. And and look, it's not that we're going to win or lose a contract on a specific idea. And I'm going to also say that practice copies each other anyway, right? So,
You just touched on one of my bugbears, so now I'm going to have to say it. Our procurement practices, the fact that you pay one practice to do all the developed design and then another practice does the documentation, and there's a line in the sand and one practice cannot talk to the other. Like, all of that design expertise literally down the toilet, and it is happening on almost every health project we do in Australia. If we can figure out how to fix that, imagine how much better we could be.
Thank you so much, and thank you so much for your insights and the recommendations that, sorry.
But one, and it's related also to, thank you, how do we effectively fund research? And several decades ago, we would have the public art policy, and it meant that there was a percentage of every capital program that went to public art, and we had a honeymoon period where we then had some great outcomes in that space. And so there's been a number of times that I've considered whether or not that is something, and whether it happens within an organisation. And I did try to sell this idea to a previous organisation I was associated to, but maybe it's actually something that we present to government, that all health projects, that there is a percentage that is actually dedicated to research, so that we have an ability to start getting a guaranteed pipeline of funding in research in whatever form. Because what I'm hearing, what my understanding is, that we don't have sufficient funding mechanism for the work we really need. So I think that would be, again, a good opportunity to perhaps engage with government and look at some kind of strategy like that. I'm not sure whether you think that's a bit pie in the sky, or...
I've been arguing for 1% for research for years, and I'm glad to hear somebody else's too.
I tried. Unsuccessfully.
Can I just make one observation around closing the loop and maybe how this might flow into government? Because what we see when we do assurance reviews across all of the states is there's a much greater focus from government on demonstrating benefits, economic benefits in particular. INSW, for example, have just redone their Gate 6 workbook to really try and understand how they better evaluate benefits. Now, we all understand that measuring health benefits is really difficult. And apologies for any economists in the room, it's a bit of a black art, and the economists come up with the models that they agree with Treasury, and Treasury say, yeah, as long as we've got as long as we've got these metrics. And then you do a Gate 6 review at somewhere like Westmead, and actually the benefits that are being measured at a local level don't relate to anything to the economic benefits that the government wants to hear. I'm just wondering whether there's a way of actually being able to really demonstrate at the outset of projects, when you're developing your benefits management framework, of linking it to the research and demonstrating that research has then flowed its way through the design, and then the real health outcomes can be attributed back to that, which will then demonstrate to government that actually if we do more research and make sure that research finding is mandated through the life cycle of a project delivery, we can actually measure those benefits and attribute them to buildings and obviously, and the built environment more than we can at the moment. Every type of social infrastructure that the government asks us to look at, to review, whether it's a POE or through a benefits, is really difficult to attribute a lot of those benefits to the built environment. And I'm sure the research could really elevate that analysis to another level.
Absolutely, I couldn't agree more. And I think longitudinal research, where we're looking at it over multi-years, multi-building types, multi-user groups, that helps build that capacity. But we're back to the time issue.
So thank you so much for your insights and also our discussion. I learned a lot. Let's put our hands together and thank our panelists.